welcome back to my channel. Throughout this episode, we're going to talk about the severity of autism, or if there is even any such thing. One of the most common criticisms I see towards the neurodiversity movement is critics accusing autistic adults of hyper-marginalising the severely autistic people as if they don't exist. This criticism is easy to crush if you understand the science and do not subject yourself to bigoted and selfish views. First, I will explain this criticism, then I will counter it and debunk it, and put some criticism towards this narrow criticism, mostly shared among bigots. First of all, there is no such thing as severity levels to autism. At a clinical diagnosis, the clinician will place all autistic individuals into one out of three divisions that we now call ASD1, ASD2 and ASD3. These divisions are not divisions of severity, they are indicators of support needs, with level 1 said to need some support, level 2 to need substantial support, and level 3 to need very substantial support. Autism is classified as a developmental disorder, meaning it is not static, it is developmental. As an individual develops throughout their life, how much support the person needs will change, meaning they can fluctuate through all three levels. The diagnosis of autism, receiving level 1, 2 or 3, is basically a starting point. The diagnosis itself is just autism spectrum disorder, ASD, no number on the end. Clinicians will use the level as a tool to help decide which interventions may be helpful and what direction to go in to help with development. A person diagnosed as ASD level 3 will most likely have speech delay or the inability to speak. This will make the clinician recommend speech therapy or speech pathology. Once the individual learns to speak, they may stop meeting the needs of ASD3 and fluctuate to ASD2. Now that the individual will be seen as ASD level 2, does that mean they have been cured of ASD level 3, of severe autism? No, nothing was cured. The individual progressed in speech development, reducing their support needs, which resulted in the individual fluctuating to ASD level 2. So there is no such thing as severe, moderate, or mild autism, just variation in how much support the individual needs. So the criticism of marginalising people with ASD3 out is contradictory to the scientific and clinical understanding of autism as we presently understand it. The critics don't seem to understand what level 1, 2 and 3 mean. So this criticism towards the neurodiversity movement is invalid to begin with, and it is entirely based on autism, but neurodiversity includes everyone. But these critics are so fixated with autism. It's as if they don't know what neurodiversity even is. Critics go claiming that people seen as ASD1, such as myself, don't experience the suffering and difficulties of those of ASD3. Self-injurious behaviours, lashing out at others. You'll notice these critics always ignore and leave ASD2 out of the picture, trying to cause a divide. They want to go backwards to the inaccuracy of classical autism and Asperger's syndrome, treating it as a static disability. Autistic adults writing articles supporting neurodiversity are falsely accused of ignoring ASD3, even though these adults were diagnosed with ASD3. But as I said, as an individual develops, they can fluctuate through the different levels, meaning they were diagnosed with ASD3, and as they went through interventions and developed, what they needed help with reduced, making them move to ASD2, and by the time they become adults, they have fluctuated to ASD1. An example of this would be my behaviour. I would be seen as someone with ASD level 1, I would. But when we look back to my childhood and teenage years, I've never seen someone who complains about autism mention behaviours as dangerous as mine. I'll give just a couple of examples of the kind of things I did. My behaviour wasn't just lashing out at people. My behaviours were things like drugging people. I was actually able to get my hands on drugs and drug people. I attempted to poison my little brother. I stayed up awake until the middle of the night and attempted to suffocate my sister. These don't seem like just lashing out or just self-injurious behaviours. These were actually attempts to murder. I attempted murder as a child. As a child and teenager, I was persistently trying to murder anyone who upset me. Now, that certainly sounds like ASD level 3. But since then, I've been taught things and I've learned how to do things like compromise, but I'm now seen as ASD level 1. And neurodiversity critics keep claiming that ASD 3 are talking over, that ASD 1 are talking over those with ASD 3. Notice how their accusations are still leaving out level 2, meaning this criticism is anti-science itself. I'll now debunk this criticism of neurodiversity advocates talking over ASD 3, not letting them have a say. First of all, we need to acknowledge that the Neurodiversity Movement actually began in the 1960s as a social justice movement to correct the social injustices caused by the racist, sexist and ableist eugenics movement. And if you notice, from the 1960s time, that's when the women's, gay and lesbian movements were occurring, due to all the sexism and so on, by the eugenics movement, claiming that females are intellectually inferior compared to men, are physically inferior compared to men, making it as if men are superior and females are inferior. So all these social justice movements are the results of the social injustices caused by the eugenics movement. So keep the 1960s in your mind for a moment. We now need to look at autism research history. Those who are called ASD1 were not seen as autistic until 1994, such as are not worthy of a diagnosis until what's called the DSM-4 edition came out in 1994. So the fact ASD1 people were not even involved with the start of the movement, that shows the neurodiversity movement was started by the intellectually disabled who were being institutionalized. So it was actually ASD3 who started the movement. So to claim that ASD3 have no say and nothing to do with the movement is contradictory to both history and the science, and is entirely contradictory altogether. In the 1980s, that's when they altered the diagnostic criteria for autism, making those now seen as ASD2 worthy of a diagnosis. So in the 80s, ASD3 and ASD2 combined and moved the movement forward. This proves all ASD1, 2 and 3 all have a say and are active parts of the neurodiversity movement ever since the 90s. ASD3 were part ever since the 1960s after the eugenics movement and the Nazi Holocaust. ASD2 were part of it ever since the 80s, and ASD1 ever since the 90s. Next, the neurodiversity critics are saying that ASD3 can't speak for themselves. They pretend there's no such category as of ASD2, and they claim ASD1 should stop talking. So what are these critics actually saying? Since they believe ASD3 have no voice, they are saying ASD3 can't talk about autism. Since they pretend ASD2 doesn't even exist, they are saying ASD2 can't talk about autism. Since they're saying ASD1 should shut up, they are basically claiming not one autistic person has the right to have their say. These critics have no problem with autistic people who disagree with the neurodiversity movement whatsoever, And this is what proves they are just bigots altogether. Having to say which proves they are bigots full of selfish bigotry. So overall, critics are saying if you agree with the neurodiversity movement, keep your mouth shut, and that you are not entitled to your views nor freedom of speech. This is where things get rather ugly and the critics can't accept the truth about their own views. The neurodiversity movement is the polar opposite of the racist, sexist and ableist eugenics movement, meaning all opposers of the neurodiversity movement are supporters of the eugenics movement, suggesting devolution, that their views make them discriminatory and prejudiced bigots, which is usually the result of either internalized ableism, self-hatred or selfishness. In summary, all autistic people have a say and a voice. If you think any autistic person has no voice, it's because you're not listening. The neurodiversity movement started back in the 1960s by the intellectually disabled and those now labelled ASD-free. So ASD-free people are active parts of the neurodiversity movement, otherwise they wouldn't have started it to begin with. Neurodiversity critics don't even understand what ASD 1, 2 and 3 mean, making them contradict the scientific and clinical understanding of autism. Neurodiversity critics are saying neurodiversity advocates are not entitled to talk about their autism or their other disabilities. And finally, opposers of the neurodiversity movement are supporters of the eugenics movement, including Francis Galton, Carl Pearson, and Ronald Fisher, three racist, sexist homophobes, transphobes, who are the ones who went causing all the social injustices across in America, in the UK where it began by Francis Galton, from his cousin Charles Darwin, then eventually the Americans influenced the Germans, and that began the Nazi Holocaust. Adolf Hitler then wanted to produce the perfect German human race, so he invaded the Polish by seeing them as genetically inferior, and by doing so he invaded Poland, but then because of dealings between Great Britain and France, as soon as Adolf Hitler invaded Poland, that's it, World War II commenced. World War II was caused by eugenics, altogether by Hitler wanting to produce the perfect German human race. So all these who are against the neurodiversity movement are actually supporters of racism, sexism, ableism, and all these different social injustices. And they think that we should eradicate such people, as if we are not even humans. We see this inside the medical system now. We're seeing it done today, genocide on those with Down syndrome. So, altogether, this criticism that ASD1 are talking over ASD2 is plain ridiculous to begin with, is invalid from the start, is not scientific but is pseudoscience. So, I would say this criticism here by anti-neurodiversity people is easily debunked. If you've made it this far, thank you for listening, and I'll see you on the next episode. If you would like to help, please subscribe. Thank you.